Good evening everybody, this is Dr. Robbie Goodrum, and I'm just going to talk to you about a clinical conundrum, a problem that's happened to a patient. So this patient here is an Indian that's travelled from India to come to see me. They've had a manipulation at the sternoclavicular joint. The thrust was delivered from anterior to posterior, and it actually drove the sternoclavicular joint too far posterior. He's getting kind of symptoms down the arm, which are from compression of the neurovascular bundle from the subclavian artery and the nerve. And so we're going to do a manipulation that's an APBC technique. Nobody's ever done it like this before, it's my invention. And so we need to, if this clavicle joint has gone in a dorsal direction, how can we spring it out and reduce the compression of the subclavian artery? So that's the question. And we're going to do the technique and show you. And okay, we've already done the assessment. So if we look at the patient now, this joint is more dorsal than this joint, and it's more inferior as well. This is the SC joint line. This is the AC joint line. So between those 2 points, just here, is the axis of rotation on the clavicle. So what we're going to do is we're going to use the patient's right hand and the thenar, between thenar and hypothenar we have a sulcus, and we're going to place it just past the axis of rotation. So there's a sternal notch, there's the SC joint, there's the AC joint, and that is the midline, and my contact point is just 1 centimetre past there. So I put my finger there, and there's the sulcus between thenar and hypothenar. I pop it onto the clavicle in that position. The patient now puts his hand on that hand there so it doesn't move. I ask him to keep that in place and this doesn't slip. Now, secondly, that when you have problems on the front of the body, you often get problems on the back of the body in an equal and opposite reaction. So, in other words, I haven't shown the full assessment and my protocol of how to find all these things. The assessment to find this is what you learn on advanced postural biomechanical correction in my program, my pending program that's coming to India. So, if in the back I've done assessment, just level with the sternoclavicular joint is T4, and T4, the costal transverse joint of T4, which we've palpated and we've tested with our protocol, is lifted. It's in a posterior direction. So the clavicle has gone in a dorsal direction, and the costal transverse joint has gone on the dorsal direction on the opposite side of the body. So we're going to do a manipulation to push the sternocostal joint back. We're going to spring it out. So it's in a dorsal direction here. We go beyond the axis of rotation. We're going to thrust here, and just like a seesaw, we're going to lift it up. You can't thrust here because you'll make it more dorsal. And you can't thrust there. You have to be just 1 centimetre finger width away from the axis of rotation. And then we're going to thrust on the patient's hand, and it will lift. This hand I'm going to contact just here, lateral to the spinous processes on the costal transverse joint of T4, which is already in a posterior direction. It's got a posterior rib head. Okay, so this is the setup. We've already done it. We've covered his face because he's shy, so he's got this Barney the Bear hat on. But I think he looks quite cute, doesn't he? You know, especially with these little bells. Okay, so here we go. So I use a flat hand. I turn the patient on their side to face me. Okay, I'm just going to double check that I've got all my marks right and the patient hasn't moved my things. Okay, so this is midline. I want just there, and that's where I want. Okay, thank you. Put your hand there. And if you can come on to your side for me, please, Mr. Sorab. And then here's 1, here's 2, double check 7. 1, not even looking, 2, 3, this is 4. This is the posterior rib. This is spine, medial spine of the scapula. This is TP. This is where the rib head is. So I'm going to feel that point, and then I'm going to use just there, between sulcus, here, between thenar and hypothenar, fingertips pointing towards the spine. Then I roll the patient onto my hand, and I'm going to lift the patient, and I'm going to thrust here, I'm going to thrust here, lean into the patient, because I need to focus the forces. Can't just thrust down. I need to roll him to develop the tension. So as I roll him to the left, then I do some side bending this way, and then I lean over, then I can feel the tension, and I get him to breathe in deep. And the thrust is done on the breath in, so we don't damage the clavicle, and the breath in is strengthen the thorax, so we don't break the clavicle itself. So he breathes in, there's a side bending, I come over, and then I can lean my body, and I thrust. And there was a cavitation, and then we reassess, and the clavicle is up, back where it was, and then we can feel these thoracic rib heads, and they are sitting back in their position. So all we've done is used levers here, down here. We've used levers beyond the axis of rotation. We thrusted here to bring this up. Don't do it on a breath in, breath out, because the breath in strengthens the thorax so you don't break the bone, so you can lift up. And we've done this actually twice to him now. Now the radicular pain and the funny feeling and the compression from the subclavian artery and nerves is already fixed in just 2 sittings. Thank you for watching. This is just another invention from myself and APBC Technique. So if you can find that technique in any textbook, you can have a free seminar. Thank you. Goodbye.